people that I've met before through my work, but also some people who I think joined us when we did this session last year. It's going to be very simple, very similar to last year. So for the folks who were here, but everybody's spiritual journey may be in a different place this year. So as Carly said, I'm the outpatient chaplain at Mount Sinai Hospital. I work at the Ruttenberg Treatment Center and the Dubin Breast Center, and I provide emotional and spiritual care to patients and families and staff as well. And I'll talk a little bit more about what that actually means in a few minutes. But before we dive in, as Carly said, we want to make sure that this is a safe and comfortable space for everybody. And we will stop recording at the point where we kind of open up the conversation around personal spirituality. But I do want to start by saying that, people have really strong feelings about their spiritual identities. It's very personal, very, very important. We're talking about sacred things here. And so I want to emphasize that the purpose of our conversation today is not to preach to one another, but to share from your own spiritual journey and your spiritual story. So we're not telling each other what or how to believe, but share about your own spiritual background and talk about what has been spiritually helpful or challenging during your cancer journeys. I also want to acknowledge that people's spirituality can change over time. So just as everybody here is at a different point in their cancer journeys, you're probably all in different places of your spiritual lives and spiritual journeys as well. Some people may be feeling more connected spiritually. Some people may be feeling less connected. Some may find a lot of strength in their faith. Some may be feeling spiritual struggles or questions or distance from their spirituality. And I just want to say that all of that is very normal and welcome in this conversation. So can I get a thumbs up or head nods that we can agree on that? Because I want everybody to feel safe and in sharing when we get to that point. Excellent. Thank you all. So first of all, I would just love to know who is with me today, because I know many of you know each other, but I don't know many of you. So if you could all just give me the name that you like to be called. I'll go around and just say the name that is on the Zoom, and you can just based on how your guys are showing up in my Zoom, and you can tell me the name that you'd like to be called, and then just one word about how you're feeling about talking about this topic today. So I will start with Hildred Rochester. Thumbs up, I see that.
Yes, I'm excited to learn about what we'll be discussing today.
Great. And is Hildred the name that you go by?
Yes.
Okay. Thank you. And Julie Coyne is next.
I go by Julie.
Okay. And one word about how you're feeling about talking about this topic today.
Good.
Good. All right. Sherry Sandler is next on my screen.
Me. Yeah, I'm excited to talk about this. I've been really interested in phenology. Once you have a life-threatening illness, it just lots of other questions come to mind. And so.
Great. And you go by Sherry?
Yes.
Okay. Yeah. Next is Danae Taylor.
Hi, Karen. I'm Danae, and you can call me Dee. I usually like going by Dee. I'm also a minister and a Christian chaplain, and I am very, very excited about when I saw you coming on. I was looking so forward to it.
Well, welcome. Thank you. Thank you, Dee. Natasha Chase is next on my list.
Yes, hi, I'm a caretaker. My mother is the patient. I'm also very excited to hear what you have to say, but I'm trying to juggle some work commitments, so I might go off video at some point. Don't mind me.
No problem. And you're Natasha?
Yes, that's
Go
right.
by? Okay. Thank you. Next is Chananchita Onate. I apologize if I'm mispronouncing that.
Oh, nice.
This is okay. You can call me Shannon.
Shannon.
Yeah, for the short one. Yeah, I really excited to with the topic and like to learn and hear. Thank
Great.
you.
Thank you. Barbara Camarda.
Art is good. I go by Barbara and I'm enthusiastic and interested in learning more and how it can help me. Thank you.
And then Barbara Saruya.
Actually, I would echo what the first Barbara said, that I'm also very eager to see, frankly, how this can be of help to me. I have focused more on Eastern spirituality, so anything else that can help, I'm interested in.
Wonderful. And you are also Barbara?
Yes, I am.
Okay.
Barbara S, I guess you could. I'm also a clinical psychologist, so I'm interested how I can use that with my own clients.
Great. Renee Palmer.
My name is Renee.
Okay. And if you're comfortable, one word about how you're feeling about this topic.
Curious.
Thank you. Joan Griffiths Vega.
Hi, my apologies for signing in 10 minutes late. I have some workers here, so if I'm distracted, please understand that that's the reason. And why am I here today? I'm always up for a good spiritual conversation. I think it's really valuable and important to our soul.
Thank you. And you go by Joan or another name? Okay. Great. Next on my screen is Natasha Chase.
Oh, I believe I already,
Yep.
yeah, I already introduced myself.
You did. You bounced around because you came off video.
I'm
adjusted.
sorry, right.
No, it's fine. Nancy.
Hi, I'm Nancy. I'm a volunteer with Women to Women.
Great.
And I'm very interested in what's going on with, what you coming on forward. I'm very interested in hearing about it. I'm also Catholic and I'm looking forward to it.
Great, thank you. Ellen Chow.
Hi, I'm just joining in and listening. Thank you.
Sure. And you go by Ellen, is that right?
Yes.
Okay. And next on my screen is Robin Findling.
Hi, good morning. I'm also one of the volunteers and I seem to be in the minority, but I would say one word on this subject for me is challenged. I'm very challenged by this subject.
Sure. And Robin, you go by Robin?
Yes, yeah.
Okay. Just like to make sure. All right, and then it looks like we have a couple of telephone numbers. 718-451-6894.
Hello, I'm Fawn. I'm just listening to learn as much as I possibly can.
Welcome. And 718-377-4423.
I'm Patricia. I just joined, so I don't know what's going on.
Sure. I'm Karen. For those who joined after the introduction, my name is Karen Terry. I'm the outpatient chaplain for the Ruttenberg Treatment Center and the Dubin Breast Center at the Mount Sinai Hospital. So I was just making sure that I had everyone's names straight for this conversation, and was asking, for one or two words from folks who feel comfortable about how they're feeling talking about spirituality. since that is the topic of today's conversation. And also for those who are just joining, we are recording the first part of this conversation, which will primarily be me explaining sort of the expectations of, or the definitions and what spiritual care is. And then we will have a short reflective exercise. And at that point, we will stop the recording so that we can talk openly and safely among ourselves. And so I think the only other person who has not introduced themselves yet is on my screen, you're coming up as R. Hamilton.
Yes, good morning, Ramona.
Ramona, okay. All right. And would you like to share a word about how you're feeling about talking about this topic, or?
Yes, it's a very important topic, you know, in my life. And I rely on it a great deal. And so when I saw the topic for today, I definitely wanted to tune in because I always feel that, you know, I can grow in that area.
Okay. All right, great. So I am going to, thank you so much, everybody, for introducing yourselves. I'm going to share a PowerPoint, but before I do, I am just curious, when you all hear the word spirituality or spiritual care, what do you think of? What comes to mind?
For me, it's more of a feeling. It's not something that you can really, you know, put your hands on.
So something intangible.
Right.
And difficult to describe, for sure.
Yes, yes.
Anyone else have something they want to suggest?
Well, for me, it's I think it is a dimension of life, first of all, and that for me there was a big conversion when, rather than thinking about spirit dwelling in me, I realized I dwelled in spirit, and I feel that it provides a great deal of comfort and spaciousness to anything that has happened to me in my life, as well as my friends and family.
Okay.
So the idea of spirit, whether that's within or without, and spaciousness and comfort.
I ran into ShopRite.
Oh, okay, that's fine.
And I see, Hildred, you raised your hand.
Yes, I was about to say that it could also be defined as what a person believes in. It is like an inner strength as to something you turn to when you as an individual cannot deal with it, but you look into that inner person that helps you and motivates you at the time.
So sources of strength and personal beliefs.
Yes.
And Danae, I see you raised your hand, and I'm gonna, just for the sake of time, have this be the last comment, and then we'll talk about the definitions that we use at Sinai. All of these are part of it for sure. You're muted, Danae.
Still muted.
Try this.
Oh, I just pressed unmute.
There we go.
Can you hear me?
We sure can.
Oh, great, great, thank you, great. Well, for me, I agree with what the other ladies say, but for me personally, in this journey that I'm on, faith and empowerment and encouragement plays a big part in my healing, and the spirituality was half of it. Not only the medical was absolutely a huge part, but faith in your faith, and I know this is a process. We know that's a process. Whatever you believe, whatever your supreme being belief is it's a process. But for me, it increased empowerment, encouragement, and faith. And that was a big part of my healing.
Yeah.
And recovery, and still is.
Thank you for sharing that. It sounds like we have a really wonderfully diverse group of approaches to spirituality, and I'm really looking forward to hearing more about your own spiritual lives and spiritual journeys in the second half of our conversation, when we won't be recording and we can have that opportunity to share openly. So I'm going to go ahead and share my PowerPoint, which is not very complicated. Let me, okay, there we go. So I'm going to start by going over the definitions of spirituality and religion that we use here, and then explain what spiritual care is at Mount Sinai and in many other places around the world as well. So the definition that we use of spirituality, as someone said, it's very hard to define. And there has been a lot of debate, even among chaplains and other people who work in spirituality and spiritual care, about what the definition of spirituality should be. This is the definition we use, which was developed by a consensus of people from different disciplines, specifically around palliative care, but I think it's just a great definition overall. It's a lot of words, so I tried to highlight the ones that I think are most important. So the definition of spirituality that we use here is: spirituality is a dynamic and intrinsic aspect of humanity. So it's dynamic, it changes over time, and it's intrinsic, which means that it is a part of all of us, that we all have a spiritual side. It's a dynamic and intrinsic aspect of humanity through which people seek ultimate meaning, purpose, and transcendence. So meaning, purpose, and something larger than yourself, and experience relationships to self, family, others, community, society, nature, and whatever it is that you find significant or sacred. And spirituality then is expressed through beliefs, values, traditions, and practices. So I think the big ones are that spirituality is innate to human beings because we are creatures who seek meaning and purpose in our lives. We are social creatures who want to have relationships and have a unique sense of or ability, experience of connecting with something larger than ourselves, whatever that may be. And then religion, there we go. Religion then is a subset of spirituality, which encompasses a system of beliefs and practices observed by a community, supported by rituals that help facilitate a relationship with whatever it is that that community considers transcendent, whether that's God, a sense of ultimate reality. In some Eastern traditions, the idea of enlightenment or nirvana, those sort of absolutes that are greater than ourselves. So when we're talking about spirituality in this group, for some people it may have to do with religion, and for others it may be broader than that. So I just want to make sure that we're all on the same wavelength with that. And so then I just want to tell you a little bit about what spiritual care is, what chaplains do, especially at Mount Sinai, but professional chaplains work in many settings. They work at they work in healthcare settings, in acute hospitals. They work in hospices. They work in assisted living or retirement communities. They work in the military, in schools. There are even some corporate chaplains. And really what I'm going to be talking about today, because this is the context that we're all in together, is healthcare chaplaincy and what that is. So spiritual care, as Carly said at the beginning, chaplains provide, attend to a person's spiritual needs and help them find meaning, courage, and hope by drawing on their own spiritual and emotional wisdom. So it's really about whoever I'm working with, whether patient or caregiver or friend or family or staff member. I'm not there to tell anybody what to believe. I am there to explore your own beliefs and what may be challenging about them, what may be helpful or giving you strength. Often we need ways of connecting with our spiritual beliefs, whether that's through rituals or prayer or just conversation about them. For many of us, it's not something we talk about every day. And so I am often a safe space where we can explore that, especially as it relates to cancer diagnoses and journeys. And so spiritual care sometimes, most often involves being a listening ear with that spiritual lens. We help people identify and live into, meaning live out their values in the context of healthcare, whether that's around decision-making for treatments or how people are finding new ways to live with whatever limitations a diagnosis may bring. We facilitate and help folks create rituals if that's important to mark milestones in their lives or treatment. Certainly, for those for whom it's important, we offer prayers or blessings from within that person's tradition or spirituality. We lead guided meditations or breathing exercises, exploration of emotions and feelings. Again, kind of going back to being a compassionate and caring, listening ear. And in that way, we do overlap with social work and other psychologists and other mental health providers. But again, with that spiritual lens, so just the training and the lens through which we come at it is slightly different. Offer guidance for spiritual questions, again, through exploring what are your spiritual beliefs and questions. We may offer things that we have learned in our training, but always with the expectation, always with the question of, here's what some people might find meaningful. Does this land with you in your heart, in your spirit? And then if there are specific religious needs, if somebody in the hospital needs a Bible, needs someone who's Catholic needs a sacrament, we'll connect people with local community clergy if we don't have somebody on the staff from your tradition. Any specific religious needs that need to be negotiated with the medical team, all of those are things that we do. And I included this quote from a Jewish Hasidic teaching because I think it speaks very strongly to the reality of living with illness and to the reason that chaplains are part of the team. And it's that a small hole in the body can cause a large hole in the soul. This idea that whatever happens to our bodies affects our spirits or our souls as well. And so as a chaplain, my job then is to attend to that part of a person, however they understand it, however that part of them is nourished, and however they relate to and connect to something beyond themselves. Are there any, I'm going to stop sharing for a moment just to allow any questions about sort of those definitions or what chaplains do, what spiritual care is.
This is Patricia. Could you repeat the definition for spirituality?
Yes, of course. It is, let me just pull it up, a dynamic and intrinsic aspect of humanity through which people seek ultimate meaning, purpose, and transcendence and experience relationship to self, family, others, community, society, nature, and the significant or sacred. Spirituality.
Significance for what?
Significant or sacred.
Oh, okay. Thank you.
Spirituality is expressed through beliefs, values, traditions, and practices.
Thank you.
You're welcome. Any other questions about what I've said so far? Okay, great. So I'm going to bring up the PowerPoint again. I want to give you all, I meant to say this at the beginning as folks were coming in and I forgot. If you can take a minute or two to grab a piece of paper and a writing utensil, a pen or a pencil, I'm gonna pull up some questions on the screen and I'll read them aloud for folks who are on the phone. And invite you all to take 5 minutes or so to reflect in writing or jot down notes. You're not going to share this with anybody unless you want to. And then we'll have a more open conversation. So Carly, I'm going to pull up the PowerPoint with those questions. And I think if you just leave it for a minute so that anybody who comes back and watches it can see those questions as well, and then stop the recording. Okay. So these
Will you read the?
Yes, I'm going to read the questions out loud for folks who are on the phone. And I do not expect you to answer all of these. Sort of think about the ones that resonate the most with you. And then the conversation that I'm hoping to have, it can certainly touch on all of these, but we're really going to focus on the last two. So I'll say that again for the folks who are on the phone and just point out those questions. So the questions on the screen are, what is it that gives your life meaning? When have you felt peace? What gives you hope? What nourishes your spirit? Have you ever had what you might describe as a spiritual moment? And what did you learn from it? And then the last two questions that we're going to focus on, but certainly don't have to only focus on in our conversation is, what are some ways your spirituality has been challenged in your life? And then how has your cancer journey impacted your spirituality? So I'm going to leave this up on the screen for those who have that video. And it is 11:34.